Welcome back to The Breakfast Show. Despite that very sad music, these days, being diagnosed with cancer is not necessarily a death sentence. In fact, if detected early, much can be done to prevent the cancer from spreading.
One of such treatments is called cryosurgery, which has changed the way doctors treat prostate and kidney cancer.
Now, we did a little research, and here's what we found. Cryosurgery is a US FDA-approved treatment against prostate cancer.
Cryosurgery is guided by ultrasound imaging, thus allowing precise treatment of cancerous tissue.
It typically takes only 1 or 2 hours, the procedure that is.
And it has shown that immense success rates from 92 to 98% in treating kidney and prostate tumors.
And cryosurgery patients typically spend only 1 night in the hospital or may even go home on the same day after their procedure. Yep, so cryosurgery is fast becoming an increasingly popular way to remove a variety of tumors around the world.
In fact, the first ever procedure of its kind conducted in Gleneagles, Kuala Lumpur was performed by our guest this morning, consultant urological surgeon Dr. Loh Chit Sin, along with Dr. John Watt from the Department of Urology in MD Anderson Cancer Center in the US.
Welcome to the show, Dr. Loh. Now, for those of us who are not familiar with the method, what exactly is cryosurgery?
Okay. Well, cryosurgery involved the using extreme cold to kill off tissues. Now, we all know that when normal tissue, whether it is malignant or normal tissues, when it is subjected to extreme of temperature, you will cause cell death. A good example is frostbites, which you see in mountaineers.
Right.
You can see the whole, fingertips turning black. Now, what we have discovered over the years is that tumor cells are, in fact, even more susceptible to this type of damage.
Right.
And if you can introduce this very extreme temperature in a controlled way and localize to where you want it to be, you can get a very selective effect. And the beauty of this is you can do that with the minimum amount of invasion to the body. And by that I mean inflicting scars.
Right.
So cryosurgery, for many years, for example, has been used by dermatologists, skin specialists, to treat skin conditions, skin warts, skin tumor. And in those days, it is a very crude way of using liquid nitrogen, cotton wool bud. Okay, and that works. But of course, with advent of technology, we have now come up with cryoprobes. These are needles through which you can pass certain gas, and the needle tip will become extremely cold.
Right. So it's almost like, if you think about it, keyhole surgery.
It is. It is a form of keyhole surgery, that's right. And so initially we were using nitrogen, liquid nitrogen, and later argon. So these days we're more using argon and helium. And so with the use of these two gases, then what you do is the tip of the needle becomes so cold that you actually literally get an ice ball forming on the needle. So it's almost like that needle becomes an ice cream stick, and the tissues around it becomes an ice cream.
Right, so you basically freeze it.
Freeze it, basically.
And then how is the tissue then removed?
So basically, after you've done that, you have to thaw it. And usually we would put through the tumor through 2 cycles of freezing, because it has been shown that it's just more effective that way. And then after that, when you remove it, the tissues will stay in there, but it will be dead tissue.
Right.
And then the body would deal with these dead cancer tissues gradually over a period of a few months.
Okay, so explain to us what we're seeing here on the screen right now.
So here you see this is the prostate. The red area is the bladder, and this pink structure is the prostate gland. And you can see these needles being introduced from the perineum. That's the part of the lower body in front of the anus. Now, these are cryoprobes. These are the needles being introduced in an orderly fashion, and these are all controlled by ultrasound imaging. And now the gas is being passed. You will slowly see white balls forming there. These are the ice balls. And these will join up together to form one big lump of ice. So you can see now the prostate is just one big lump of ice.
Right.
And then following thawing, the ice will melt. And then, of course, you do that again, a second cycle, and then later you just pull out the needles. And so essentially the patients just have a few holes in his perineums rather than a big cut on his tummy.
Right. Oh, that's fantastic. And how often has this been performed in KL now?
Well,
Just once or?
Well, for the prostate, just once, because this is so new. But cryosurgery is not new. Cryosurgery has been around, certainly in America, for at least 10, 15 years.
10, 15 years.
As far as the prostate, the kidneys, the livers are concerned.
And how early of a stage of cancer does someone have, to be detected before they can actually go through this surgery?
Well, it depends on what type of cancers and of which organ. But as far as the prostate is concerned, there are many other treatment modalities which are very effective,
Right.
albeit more invasive.
Right.
Cryosurgery is very safe, but it does also have some drawbacks. For example, if I had prostate cancer, I would not choose cryosurgery simply because I'm still sexually active.
Right.
And while cryosurgery is very effective on the cancer, it's not very good on your erection.
Right.
So you have to pick and choose. But if you have a patient who is not so suitable for surgery, maybe other general medical conditions, anesthetic risk and all that, then this would quite clearly be a very good substitute.
Now, how is this procedure used for kidney as well? Because it's been said that it's quite widely used for kidney cancer.
Yeah. Well, the thing about kidneys is that, you see, with increasing access to ultrasound scans, we are now diagnosing kidney cancers at an earlier and earlier stage.
Right.
So you can pick up kidney cancers as small as 1 to 2 centimeter. And the traditional way of treating kidney cancers is to take the whole kidney out. And it will be such a waste of normal kidney tissue when you have one tiny portion of the kidney affected and you have to take out the whole kidney. Now, with cryosurgery, you can preserve the kidney. And you can do so without inflicting big scar. Basically, just a few puncture holes in the skin. You direct the needle exactly into where the tumor is, just freeze it up, and the rest of the kidney is left totally intact. And so the person continue to have 2 kidneys instead of
just one.
Just one.
Yeah.
Now, is research being done to conduct cryosurgery on other types of cancers?
Yes, very, very much so. And the FDA has certainly approved cryosurgery for the use for the following cancers: lung cancers, liver cancers, and breast cancers. There's a lot of work being done at the moment. And certainly breast cancers, it would be very attractive for some women because of the cosmetic, cosmetic reasons.
Right.
And of course bone cancers as well.
And how far do you see that this popularity of this method will be used here in Malaysia?
As far as we know, it is already very popular, but only with a certain sector of our society. Because what we know is one of the largest cryosurgery centers is the Fuda Medical Center in Guangzhou.
Okay.
And with the Chinese community, many Chinese patients had actually privately gone to Guangzhou to have it treated. And I have myself had a couple of patients who has had it treated in Guangzhou and back. And I understand there are even agents in town who will sign you up and take you there for treatment. The demand is quite clearly there. It is just that, until now, we have not been able to offer this.
Right.
And for the first time now, we are able to offer this in our country.
Okay.
Right.
Well, that's good news.
What you think is the determining or the underlying factors when it comes to deciding to have cryosurgery or go the traditional route?
You have to be guided by your doctor because, each organ, the cancer of each organ's treatment choices are very, very complex. The decisions involved in whether to choose this treatment against that treatment, you have to properly go through it with your doctors because, sometimes success and cure is more important than scar. Sometimes anesthetic risk is worth taking because of clear difference in outcome. Sometimes, it's just too dangerous to do this and that.
Right.
And so you cannot generalize. You have to individualize and you have to discuss it quite carefully with your doctor.
So quite a lot of factors actually are involved in deciding.
Exactly. But what is important is, you must also realize that there is this option. Because sometimes patients do not know it, and this option is not brought up as a consideration.
Right.
And so it's passed, people just end up having surgery simply because nobody knows that there's an option, and so you don't go and explore it.
Okay. Now, last question. I think it'll come down to cost.
Yes.
That's always on top
Cost
of every...
and success rate as well.
Cost and success rate. I mean, is it more costly than the traditional other forms?
Inevitably, because what you have to understand is this. This is a US technology, and of course the technology is denominated in the US. Our basic health cost is very, very cheap because our hospitals are constructions is cheap, our nurses pay and all that compared to international standard, of course.
Right.
So when you look at it like that, it is actually very expensive in Malaysia. But if you look at it in the US, in Europe, it is actually very competitive. It compares well with conventional surgery. If you're talking about treating kidney cancers, depending on the size, because how many probes, how many of those needles you use very much affect the cost. But a ballpark figure may be somewhere in the region of 50,000 ringgit. 50,000 ringgit,
okay. And success rate, we were talking about success rate?
If you apply it in the correct setting as recommended, then the results is the same as conventional treatment. That means surgery.
Right. Thank you very much for that, Dr.
My
Loh.
pleasure.
And if you'd like more information on these cryosurgery, you can actually visit the Gleneagles KL or log on to their website, and that would be www.gleneagleskl.com.my.
On that note, we're going to take a quick break, but